Hello, I am Travis Hauser, and I'm the Associate Director of the Network Provider Assistance Unit. Today, Ms. Linda and I will discuss the following objectives. The DHCP Selection Referral Requirement Update, the Sterilization Claims and Consent Form Review, Billing of Maternity Services Education, and the Patient Center Medical Home or PCMH attestation reminder for applicable providers. The DHCP Selection Referral Requirement. Effective July the 1st, 2021, the agency has decided to reinstate the DHCP Selection Referral Requirement. What this means is that all maternity claims with dates of services of July 1st, 2021 and beyond will require a DHCP selection referral from the ACHN. This is basically the same requirement for any maternity services that was required prior to the COVID-19 emergency. The DHCP selection referral form ensures collaborative communication between the DHCP and the ACHN for quality health outcomes. One note that I would like to point out is that any maternity claims with dates of services of March 16, 2020 to June 30th, 2021 will not require a DHCP selection referral. If you have denied claims between that time period for the DHCP selection referral requirement, please reach out to the agency or Gainwell so that we can research those issues for you. Again, the DHCP selection referral form can be obtained by contacting the ACHN, in which the recipient is assigned to on the date of service, and they can provide the DHCP selection referral form to you. This slide is just a visual display of what the DHCP selection referral form looks like. Again, you can obtain this form from the recipient's assigned ACHN for the date of service that you're trying to cover. At this time, I will pass it over to Ms. Linda White, who will discuss sterilization consent forms.
Good afternoon. This is Linda White with the Division of Managed Care Operations. I'm in the unit of the Maternity, Family Planning, and Plan First unit. I will be discussing the importance of filling out Form 193, the Sterilization Consent Form. Medicaid is governed by CMS. We follow the Code of Federal Regulations, and Medicaid must adhere to the guidelines outlined in the 42 CFR Part 50 when accepting sterilization consent forms. Consent forms must be signed and dated by all of the following: individual to be sterilized, interpreter if one is provided, the person who obtains the consent, the physician who will be performing the sterilization procedure. And also, all of these individuals must date their signature the day that they are doing this. In the slides, a slide of 193 will be shown in the presentation at a later time. But we are going to talk about non-correctable fields. Non-correctable field is a field that cannot be changed, edited, or revised once sterilization consent form has been submitted to Gainwell. The recipient's signatures are not correctable. The recipient's signature must match or resemble the signature of the recipient's verification documentation requested. Field 7 is for the signature, recipient's signature. Field 8 is for the date signed. Block 12 is for the signature of the interpreter. 13 is for the date signed, if that is needed. Field 16, the signature of the person obtaining the consent. And 17 is for the date of that is signed. These all must be done in black ink for the signature and the date. Please note that Gainwell will return forms to providers upon document identification of missing information in correctable fields. However, consent forms submitted to Gainwell with missing or invalid information in non-correctable fields 7 and 8, 12 and 13, 16 and 17 of the consent form will be denied by Gainwell and will not be returned to the provider. Therefore, all claims associated with this sterilization will not be paid. That means that your physician, the hospital, nor the anesthesia will pay. Now we see the consent form here with the on the form 193. Before you send this form to Gainwell and get a barcode, as long as you have the form 193 in your office, you can correct the non-correctable fields. But once you send it to Gainwell, nothing can be changed in the non-correctable fields. So please, you see the highlighted areas that are on the form 193, and those are the very, very important. Those are the fields that are going to have to be approved as good and solid, done very well for your money. And so we see this copy of the form 193. Now we see a signature that is not acceptable, that does not match or have the verification does not match. You see this on the left side, the signature there, or that's some kind of marking, and the date. That is not acceptable, and you see the verification or the confirmation of what is supposed to be over there signed does not match anything at all. This will be denied. Signatures should be affixed by the person who is being sterilized in such a manner as she usually signs the name in his or her hand during the regular and daily course of business, such as signing a check, a legal document, or her driver's license. Then we will see the top reasons for returns, and then you will, on the same page, you will see the top reason for denials. And this is found on page C51 of the provider manual. So you have the top reasons for return and the top reasons for your denial. And as I said, you can find this on C51 of the provider manual. Now, where to get help for sterilization consent form 193. You will find this in the manual, Appendix C, the provider billing manual, and this is updated quarterly. The instructions on completing the consent form 193 are found on pages C45 through C49, showing how each field 1 through 28 with description of what goes in each field and instructions about how to do in each field. Please remember, and it also has here where you can contact Gainwell representatives. There's a number there, and 2 numbers to contact them. Please remember, and if all else, I beg you to look at this form before you send it to Gainwell and be sure that the signatures and the dates are all correct. If it's not, before it leaves your office, you can tear that consent form up and start all over again. It is so very, very important, because if this consent form signatures are not correct, that stops payment for the provider, the hospital, and the anesthesiologist. Please remember, Form 193 is the first step in getting your services paid for. Thank you.
Thank you, Ms. Linda. Our next topic is maternity billing. Just a quick reminder about global maternity codes. Global maternity codes applies to the delivery codes, which includes the prenatal, delivery, and postpartum services. Just a reminder that the physicians are reimbursed at 100%, and the mid-level practitioners are reimbursed at 80%. In some situations, you do have the option to unbundle those global codes. Unbundle when appropriate. You may have some instances in which all of the services are not provided by the mid-level or the physician. In those situations, you can unbundle when appropriate. Mid-level practitioners can only be reimbursed for qualifying delivery-related procedure codes. And this is the same as stated previously. Physicians are reimbursed at 100%, and mid-level practitioners are reimbursed at 80%. Delivery claims should support actual services rendered and the rendering provider. DHCP bonus payments. DHCP bonus payments is another opportunity in which the DHCP can earn bonus payments. The first bonus payment is the prenatal bonus payment. If you see the recipient within the last 90 days of her menstrual period, then you may qualify for the prenatal bonus payment. You will need to bill procedure code H1000 on a separate claim, and you will be eligible for $100 per bonus payment. There can be exceptions to this rule. If you bill this bonus payment, it is denied. Maybe the mother miscarried and now she's pregnant again. In those type of situations, you will need to forward that information to the agency. Send us the physical claim form, and we'll review the claim to see if it can be overridden, and you can be paid for that bonus. We do have override procedures outlined in Chapter 40 of the Provider Billing Manual. The second bonus payment type is the postpartum bonus payment. The postpartum bonus payment, you'll be eligible if you see the recipient between 21 and 56 days of delivery. You will bill procedure code G9357. Please ensure that a paid delivery claim is on file in order for this bonus payment to be paid. If there's not a paid delivery on file in our system, the claim will deny. Again, you'll be paid $100 per postpartum bonus payment per recipient if they qualify. An exception can also be made to this rule. For instance, if a recipient delivers outside of the hospital or out of state, you will send that information to us by sending us a physical copy of the claim. And again, override procedures are outlined in Chapter 40 of the Provider Billing Manual. Just some key tips when billing the DHCP bonus payment. These bonus payments must be filed on a separate claim. You cannot bill them on the same claim with your services on the 1500 claim. If you do so, those bonus payments will deny. You may only receive one prenatal bonus payment or one postpartum bonus payment per recipient per pregnancy. An override can be made to this rule for the examples that I provided earlier. You can receive a prenatal and a postpartum payment for the same recipient, so that can possibly be up to $200 per recipient. But again, make sure you bill those bonus payments on a separate claim. If not, they will be denied. If you need help with billing these bonus payments or any maternity service, please reach out to your Gainwell provider representative and they'll be happy to assist you with the billing. This slide here shows some of the missed bonus payment opportunities from fiscal year 2020. I would like to call your attention to the lower right-hand corner. There was approximately $3.5 million, that's million with an M, $1 million that was missed in fiscal year 2020 for bonus payment opportunities. Again, if you have seen your recipient within the last 90 days of her menstrual period, you may be eligible to receive the prenatal bonus payment. If you see her within 21 and 56 days of the delivery and there is a paid delivery on file, you may be eligible to receive the postpartum bonus payment. You can receive both bonus payments for the same recipient. However, if that recipient has seen a previous DHCP during the same pregnancy, and that DHCP has already billed and been paid that bonus payment, then you will not be eligible for it. So make sure when you see these recipients, make sure you go ahead and bill those claims so that you can get that extra $100. Again, there was approximately $3.5 million missed. Keep in mind that you have 365 days to submit claims to the agency. So if you want to go back and review your claims or any of your chart or medical documentation, and for whatever reason you notice that you forgot or maybe missed some of the bonus payment for those recipients that you've seen, you have 365 days to get those claims to us. So you still have some time to get that information to us, and there's possibly you can retrieve those bonus payments that were missed. All right, our next topic is the patient-centered medical home attestation. And before we get into this, I would like to make a disclaimer that this only applies to OBGYN primary care physicians that are also enrolled as a PCP with the ACHN. That means that they have signed an agency agreement with the agency, and they have also signed ACHN participation agreement with one of the 7 ACHN entities. So if you're an OBGYN that is operating as a PCP and you're interested in receiving the PCMH bonus payment, this information is for you. For the interested, eligible OBGYN PCP provider groups, PCMH attestation for fiscal year 2022 is due no later than October 1st, 2021. We want to iterate that if you would like to take advantage of this 5% bonus payment, go ahead and begin your PCMH recognition now to avoid potential delays. What we found out last year is that some providers waited to basically start their PCMH recognition process, and they pretty much ran out of time because PCMH recognition can take some time to complete. So to avoid delay in your missing the deadline of October the 1st, go ahead and start that PCMH recognition now so that you won't miss the deadline. Attestation is required to be eligible for the 5% bonus payment. Another thing I would like to point out is that attestation is separate from recognition. Recognition is the actual process that you have to complete with one of the PCMH certified entities. So first you have to get recognized, and then the second step is you have to attest to the agency, and that's where we come in. You will have to complete the attestation form, basically attesting that you have received PCMH recognition, and you will also have to submit proof that you're either in the process of completing it and have made adequate progress, or you have actually achieved that that recognition. The attestation form is available on our website via the following link. You will fill that form out and submit the supporting documentation and send it to the address, or you can fax it or email it to the information that's on the form. If you need assistance or you have questions about the PCMH attestation process, please email us at achn@medicaid.alabama.gov, and we'll be happy to assist with that. Okay, our last slide here is just program contact information. If you have questions or concerns about the Maternity, Family Planning, and Plan First program, you can contact one of the ladies mentioned on the slide. If you have questions about the DHCP bonus payment or the PCMH attestation process, you may contact one of the people in the next network provider assistance unit that's on the slide. You can also reach out to us at achn@medicaid.alabama.gov, and we monitor that email account, and we'll provide you with an official response via that email. Thank you for your time.